If you or your partner are disappointed about what's been going on in the bedroom and you're concerned about ED, you've come to the right video. Hi, I'm Dr. Hampton, and as you know, I'm on a mission to help you achieve metabolic health. I promise if you hang in there by the end of this video, you'll know everything you'll need to know to restore happiness into your bedroom. And this video is not just for those who are 65 and over. This is for anybody who's trying to improve their functioning in the bedroom. So let's get started by understanding what is metabolic health. And it's really about what's pictured in this image. It's about not having too much belly fat, having normal blood sugars, a normal blood pressure, and of course, a stable appetite where you're not always hungry, having energy, and of course, your muscles, bones, and joints working like they should. But did you know that one of the earliest signs of poor metabolic health is actually not having the ability to have an erection, right? Who knew, right? Well, this ideal of erectile dysfunction reminds me of what the coal miners did in the 20th century when they would bring canaries into coal mines as an early warning sign for toxic gases, primarily carbon monoxide. The birds, being more sensitive, would become sick before the miners, who would then have a chance to escape or put protective respirators on. It was really an exciting time for me to go to Chicago's Museum of Science and Industry. I would go with my family and or with my school when I was a kid. And this is when I learned all of these important mysteries. I never knew I'd be sharing it now as an adult. So while the canary is a great predictor of carbon monoxide, erectile dysfunction is a great predictor of cardiovascular disease, because when those small vessels in the penis, as pictured, get clogged, it's likely you will have a clogged artery somewhere else in your body. And in this case, you have small vessels in your heart as well. So believe it or not, you literally have a canary in your pants serving as a warning sign that you may have issues with your heart health. So it's really important to know that not only does it have a sign that you're at risk for heart disease, but the worse your erectile dysfunction is, the more likely you have a more advanced version of heart disease. So before we get started, guys, I want to talk about the number needed to treat, because what that will do is explain the likelihood that any drug that's being used or any intervention is going to be effective. And the goal is to have a smaller number. So if you use the example here, the number needed to treat and for this drug is 4. And all that means is that just 4 patients need to be treated with that drug to get one person to benefit. So imagine if that number is smaller, less people need to be treated to get a benefit as opposed to a much higher number. So the goal is a smaller number for your number needed to treat. Now, statins, as you know, many people in the low carb community fuss about statins, right? Well, here's one reason why. The number needed to treat in this particular study was 60 for a heart attack and 268 for stroke, meaning that at least 60 people have to be treated to benefit one person for a heart attack. And as you can see, a much higher number for stroke. I've seen this number as high as 400, giving statins to people who are at low risk for heart disease, and can be as low as 25 in people in high risk. So again, the number needed to treat is really important. So let's talk about the drugs that we use in conventional medicine to treat erectile dysfunction. They're called phosphodiesterase inhibitors. The good news is that their number needed to treat is only 2. So that's a really good number. And as you can see, what these drugs do is they block the phosphodiesterase enzyme, keep it from working, which then leads to relaxation of your blood vessels and increased blood flow. So it's really a great drug for people with erectile dysfunction. And as you can see, pulmonary hypertension. So by increasing blood flow, it really improves erectile dysfunction. But again, the key thing to remember is that the number needed to treat is really small. So here are the examples. You've heard of these drugs before. Things like the brand names being Levitra, Cialis, and Viagra. And when do they work? They vary. But all these drugs are very effective. The one that kind of got this whole drug thing started was Viagra. And believe it or not, they have the lowest dropout rate. So contrary to popular opinion, Viagra is the drug that actually seems to have stood the test of time. And of course, it's because of that it's been around for a while. It's also the most affordable. And but the problem with these drugs, just like any drug, there's side effects, right? So let's think about some of the side effects real quick. And we've all heard the joke that if you take these drugs, you can go blind. Well, actually, that's actually a real possibility. Drugs like Viagra can actually affect your vision, but when you have really high doses of these drugs, it can actually lead to blindness in some people. Another side effect in some people is they can get hearing loss. So they can affect your hearing. And finally, the one that's really scary also is priapism. And if you look to the left, you'll see that there's the normal arterial and venous flow. And then when you look to the middle image, that's when the venous outflow is blocked, which then leads to an erection that won't go away. And finally, to the right, when this happens, it's an emergency. And when that happens, you can do procedures. Now, what you see to the right is a surgical shunt procedure for priapism. It's known as a T-shunt, where they create a channel between the corpus cavernosum and glans penis to allow blood to drain and circulate to and return to normal. So kind of scary, something they do in the ER, but you just need to know that these are potential side effects of drugs, which is why we try not to use drugs if we don't have to. Now, let's look at some of the treatments that are also popular for erectile dysfunction. We'll start with the traditional treatments like testosterone gel. The number needed to treat for that is 2.1. So as you can see, that's a pretty low number, and that's a very positive sign that for those who benefit from it, it would work. The problem is for this particular intervention is that you really want to treat people who have ultra low testosterone levels, literally less than 50. When you use it for people who are in the 250 to or higher range, it tends not to work as well. So the data supports ultra low levels, not people who are mildly reduced in their testosterone levels. So I just wanted to put that in front of you and let you know. There's also injectables that are helpful that can be injected into the penis to help create an erection. The number needed to treat for this type of treatment is in the 3.5 range, so also very effective, but not very popular because a lot of people do not want to inject anything into their penis. But it is something that's worth talking to the urologist about if you're having trouble with these other conventional treatments. Now, let's go into more of a natural realm. And the first one I wanted to mention is yohimbine. Yohimbine is thought to alleviate erection dysfunction by blocking receptors responsible for preventing erections and promoting the release of nitric oxide. Nitric oxide causes the blood vessels to open up. Believe it or not, the number needed to treat for this more natural intervention is 6.4. So still not a bad number, especially when you compare it to those statins. Here's another supplement that's been very helpful. It's called saw palmetto. You've heard of it before. The exact mechanism of action is not very clear, but it is something that impacts the phosphodiesterase enzyme. So there's been enough research to show that this is something you should consider as well. Now, when it comes to a pump, you may ask, well, what the heck is the doctor talking about now? A pump, this is something I've seen in the back of a magazine. This can't be real, right? Well, actually, that's not true. Pumps are very effective at helping people restore erections. If you think about it, the penis is a muscle, right? And that muscle needs to go to the gym. So this is literally a version of going to the gym for a guy who needs it. It's very effective. And again, as I said, starting this video, this is something that would benefit a younger person as well as a person who doesn't have erections by making the penis stronger and in some cases even bigger by using a pump. So it's very effective. It's not a short-term quick fix kind of thing. This is something literally you do over time to restore the penis. And it's really an amazing tool. So if you decide to utilize this tool, you'll have to measure the roundness of your penis because they come in small, medium, and large. And you want to make sure you get the right size for your body part. You also want to have sufficient lubrication, make sure the hair is cut low. And if done properly, you can restore the health of your penis. You also can get this exact same pump as a electric version. Many of my patients choose to do the handheld pump, but it's important to know that those are options as well. Another supplement I want to throw at you is a supplement called citrulline. They find it's more effective to take citrulline, which then becomes arginine and ultimately nitric oxide. And they feel that that's the most effective way to do it. So that's another great supplement that you may want to consider. I believe in these ideas so much that I actually created a link tree. So if you're looking to look into either the pump, you can actually go to this link tree. It's an affiliate link, of course. And of course, the citrulline, there's a supplement called Flow that has citrulline in it. And I'll also throw in that desire is for increasing your libido. So those are things you can do that are natural that I think you should consider if you're checking out this video. Now let's talk about some of the things that negatively affect your ability to get erections. And we'll start with trazodone. And trazodone, believe it or not, has two reasons why it's not really effective for ED. Number one is that it simply doesn't work very well. And number two, it increases your risk for priapism, where you can't get that erection to go down. So let's not use trazodone. Number two are statins. So you had one reason not to be excited about statins because their number needed to treat is so high. But secondarily, statins actually increase your risk for having erectile dysfunction in the first place. And it's not just statins that deal with your cholesterol, it's also those fenofibrates or fibrates, those medicines which are used for cholesterol and for your triglycerides are also known to increase your risk for erectile dysfunction. Now, one of the things that definitely increases your risk for erectile dysfunction is not being at your ideal body weight. And when you have a lot of abdominal fat, that tends to store estrogen, which then tends to reduce your testosterone. So being a little thinner is one of the most important things you can do to reduce your risk for erectile dysfunction. So if you come to this video and you're like, well, what would the metabolic health doc do, if he was faced with this type of problem? The first thing I would do is if I was overweight, I would lose weight. So I would focus on changing my diet to make sure that I was at a more optimal weight. If I was a smoker, I would stop smoking because smoking will absolutely increase your risk for erectile dysfunction because it causes a lot of inflammation in the arteries that are necessary to function properly in your favorite body part. I would exercise because it's all about your circulation, right? So the more you exercise, in fact, I would argue, and what I hear from my patients is that on the days they exercise, they tend to perform better. So you don't have to exercise every day, but you need to know that exercise will have a direct correlation between exercise and your ability to have an erection. Stress is definitely something I would work on. I would reduce my stress. I would learn how to meditate or whatever it takes to reduce the stress in your life. And also what I would do is I would adopt a low carb, keto, or carnivore diet because in order to make testosterone, believe it or not, you need fat and cholesterol. So you need fat to make testosterone. So people on a low fat diet tend to have more erectile dysfunction issues. People on a higher fat diet like low carb, keto, or carnivore tend to have less erectile dysfunction. I would consider experimenting with the supplement citrulline, which of course becomes arginine and then nitric oxide. Maybe experiment with yohimbine or saw palmetto as well, because again, these are natural things you can do to enhance your erection function. And of course, that pump, it may be of the things I've listed today, the pump I think is the most effective way to improve your sexual health because it restores the muscles. And I would use medicine as bridge therapy. So it's okay to use those phosphodiesterase inhibitors. It's okay to use those medicines, but it's possible that if you do the lifestyle changes, diet, exercise, the appropriate supplementation, and the pump, you may not need the medicine. So I think that's a better approach as a long-term strategy. And I really think it's important that everybody realize that no matter what your age, you deserve to have a healthy sexual experience with your partner. And if you understand these principles and apply them, I guarantee you that's what's going to happen. So I hope this video added some perspective, gave you another way to address this issue than, instead of just simply relying on pills. But now you have another way to address it that's more natural and holistic. So I thank you again for coming to the Metabolic Health Docs YouTube channel. And until the next video, continue to be safe, be well, and continue to protect your nest.